November 12, 2017, 3:22 p.m. EST. Sex is rarely a trigger for a sudden cardiac arrest, but when it happens, only a third of people who collapse during sex are likely to receive CPR from their partners, a new study finds. Researchers who examined the records of more than 4,500 cases of sudden cardiac arrests found a total of 34 linked to sexual activity, 94% of them involving men. However, their partners were alarmingly reluctant to attempt CPR. This likely explains the relatively low survival rates despite mostly shockable initial cardiac arrest rhythms, the researchers report in a study published Sunday in the Journal of the American College of Cardiology. The finding surprised and puzzled the researchers. There is plenty of evidence that performing CPR by bystanders until the ambulance arrives translates to significantly better survival for cardiac arrest, said first author A. Poero, of Cedars-Sinai Heart Institute in Los Angeles. By definition, a cardiac arrest occurring during sexual activity is witnessed by a partner, and if CPR would have been initiated by the partner, this would have been likely to save the lives of some of these patients. If CPR would have been initiated by the partner, this would have been likely to save the lives of some of these patients. Sex isn't without risk, Arrow and his co-authors write. In one German study, 0.2% of autopsied natural deaths were linked to sex. It is also recognized that sexual activity may trigger non-fatal acute cardiac events such as myocardial infarction, heart attack, the team writes. Sudden cardiac arrest, a sudden collapse and loss of pulse, isn't the same as a heart attack. A heart attack occurs when blood supply to the heart is slowed or stopped because of a blockage. With cardiac arrest, the heart abruptly stops beating. It's a mostly lethal condition, resulting in more than 300,000 deaths annually in the U.S., the authors write, as well as 35,000 to 45,000 in Canada. Cardiologist Drive Sumit Chugh, the study's senior author and director of the Heart Rhythm Center at the Cedars-Sinai Heart Institute, said patients often ask about the risks of having sex. There was no data out there to tell them whether their risk is low, medium or high, he said. So the researchers analyzed data from the Oregon Sudden Unexpected Death Study, ongoing since 2002 and the largest community-based study of its kind involving a population of about 1 million people in Portland. The study has collected detailed information, including past medical history, blood, genetic and other markers of risk from people who literally drop dead in their homes or anywhere outside hospital, Chugh said. In total, the researchers identified 4,557 sudden cardiac arrests in Portland from 2002 to 2015, 34 occurred during or in the minutes after sex. On average, these people were more likely to be male, middle-aged and have a history of heart disease. Overall, 1 in 100 cases of cardiac arrest in men was associated with sex, compared with 1 in 1,000 in women. The absolute risk appears to be extremely low, the authors write, even among people with known heart disease.